Hello, everybody. Welcome in. My name's Andy Manos. I'm a PA in interventional radiology here in Minneapolis at North Star Vascular and Interventional. And today we are going to talk about something no one really likes to talk about, but something pretty important and very common. So we're going to talk about hemorrhoids and understanding your options from simple treatments you can do at home to things that are more invasive. Yeah, no one likes to talk about this, right? So these are hemorrhoids. These are things that are problems. If you've ever taken a shower because you had some blood in the toilet, if you ever wore a pad or a diaper out in public because you're worried about saturating yourself, if you ever took a picture or had someone, a loved one, take a picture for you to see what was going on, you are not alone. These are things that I have seen all the time. I hear about it. You're not alone if you're doing those things. Hemorrhoids are super common. So we are going to talk all about that. This whole webinar here is going to be about learning about hemorrhoids. So I know it's not fun to talk about, but it's something that's really common and we see here a lot of, and we have a cool treatment for, which I'll talk about in a little bit. So they're really common. A lot of people, about half of people have them by age 50. You can look at colonoscopy research and see that it's like between a third and so 30 and 40% of routine colonoscopies will have internal hemorrhoids on the exam. So they're super popular. Common doesn't mean they're normal. Okay, so they can become abnormal. You might not know that you have them, but at some point they may become noticeable because you might have symptoms. So what are those symptoms? Bleeding, itching, pressure, pain, anxiety surrounding leaving the house because you have this. Those are all if you have those, that is not normal. Okay, so if that's happening, it's definitely not normal. And while it is prevalent, it's not necessarily normal, like I said. So if you've ever planned your day around a bathroom, you understand a lot of those things that I mentioned before about showering or looking at yourself in a mirror, taking a picture, that type of thing. Then this talk is for you. Let's start with what are hemorrhoids? What is a hemorrhoid? Okay, so they're swollen blood vessels. Let's just think of it like that. This picture is a drawing of anatomy, but that is the end of the large intestine, which is the rectum and the anus. And it's just very robust with blood vessels, both arteries and veins in this area. And with pressure, it can cause changes in these blood vessels, and that's what hemorrhoids are. Pressure changes everything here, right? So constipation is obviously going to cause pressure in that area. Pregnancy, continuous and heavy lifting, straining, prolonged sitting, and just aging and the connective tissue in that area becoming not less healthy, but not as young, I guess we could say, will make hemorrhoids a little bit more prevalent. Not all hemorrhoids are the same. So there are two different types of hemorrhoids. You have internal hemorrhoids and external hemorrhoids. At the surface, that sounds pretty simple, but it's actually not, and that's something we're going to get into here in a second. How do you know which one that you have, internal versus external? Well, you'd have to come see me or come see a physician or provider who can diagnose you with something. So you start with anoscopy. That's an in-office way to look at this area to be able to tell what kind of hemorrhoids you have. A physical exam. Sigmoidoscopy is more involved, but then a lot of people have heard of a colonoscopy, of course, and you would obviously see this area there as well as the rest of the large intestine. Let's start with external hemorrhoids. External hemorrhoids is truly external. In medicine or in our training, there's this dentate line, which basically delineates external from internal. But these are going to be outside. These are the things that you can see. These are typically very painful, especially if they've a little bit of that blood has clotted inside of that hemorrhoid. These can be really itchy. These are external hemorrhoids. These can get there can be a lot of them. They can cover the whole area. They can be very large, they can be very problematic. Those are external hemorrhoids, and those are the blood vessels that are closest to the outside that are the ones that are swollen, that pressure has made them enlarge. That's an external hemorrhoid. Let's talk about internal hemorrhoids next. Internal hemorrhoids, it's a completely different blood supply just by the way the anatomy works, but this is now above the dentate line. These are internal hemorrhoids. These are the blood vessels a little bit further up inside that have become swollen, and they start to enlarge like this, and they might kind of outpouch like this, and they may actually come all the way out, and we call that prolapse. So these are the ones that are inside. These are usually not associated with pain. These are hemorrhoids that are typically going to cause bleeding, and if they get big enough, they can prolapse out. So something is actually hanging out of you, which can be easily confused for an external hemorrhoid. But on an exam, it can be determined which one that it is. So in summary, the problem is not just irritation in the area; it's related to blood flow. A lot of people who are dealing with hemorrhoids go through a cycle, and they have something come on and then it flares up, and they usually are going to Google something or go to the pharmacy and they're going to get a cream. They're going to try that and it's going to help a little bit. And I say, great, I'm good for a while. Great, it's gone. And then it's going to come back. It's going to flare up again, and they're going to start this process. And I've heard many patients tell me, "Gosh, I've tried these things in preparation H." Um, and it's a cycle. So they don't necessarily go away. They do wax and wane in severity. But one really important thing I want to talk about is they're not going to become cancer. A lot of people are concerned about that. Hemorrhoids don't become cancer, but bleeding needs to be evaluated. So hemorrhoids don't just turn into cancer, but if you have bleeding, it has to be evaluated by a provider. There are other things that can cause bleeding. So having a diagnosis of hemorrhoids versus something else that can cause bleeding is important. Many people are going to improve without any type of procedure. Simple changes can help. So a lot of this is towards pressure and bowel habits and avoiding constipation, but talk about making sure you have enough fiber. And if you have enough fiber, you need enough water. Exercise, of course, is always helpful in our health. Avoiding straining if possible. Bathroom habits. What I mean by that would be like scheduling bathroom breaks so you're not, essentially holding it or causing constipation. And even some patients will take stool softeners to prevent that constipation. That will oftentimes allow the hemorrhoid to calm down. Other common home remedies would be sitz baths. The cream is by far the most commonly used, I would say. Witch hazel can be really helpful, especially if you're having pain or itching. Wipes, ice. People use ice quite a bit for this too. But it's not always long-term relief, going back to that cycle. So those things can help, but they're not going to provide long-term relief. Like I said, do not ignore the bleeding. It is important for that to be looked at. So when would you need to do more than just the home remedies? If you're having persistent bleeding, so wasn't bleeding just once, or maybe for a few days, maybe it was something that keeps happening every month or every week. That's needs to be evaluated. If the symptoms just come back again and again, if you're notice, is something hanging out of me? Is this prolapse? A lot of people are able to reduce the prolapse or push the tissue back up inside. If you're having pain that you just do not think you need to be having, or if you're literally making decisions around this, and I'm not going to go see my friends, I'm not going to go out shopping because I'm too worried that I might have blood, or if there's a mucus discharge or smell associated with it. A lot of people are now starting to make decisions based off of this. Those are all great reasons to be checked out. Not everybody needs a procedure. Talked about that, but let's talk about the procedures that would be offered to you. You have uh, these are treatments that will be done in the office. So this is going to be our colleagues in colorectal surgery that are going to offer these, but there's rubber band ligation. They actually put a rubber band around the hemorrhoid and it kind of strangulates it and it causes it to shrink and basically fall off. Something called infrared coagulation, just a different way to get rid of internal hemorrhoid. And then sclerotherapy is like a medicine or a detergent used to kind of irritate the internal hemorrhoid and make it go away. And all of these can be great options. They can work well in selected patients. They tend to be painful. And sometimes, if it's bad enough, surgery is the right answer. So this again, a colorectal surgeon will be able to offer a few different surgical options, especially if these hemorrhoids are advanced. It can work. So surgery can work, but recovery can be difficult. Typically, hemorrhoid-related surgeries are very painful for a period of time, and recovery can be difficult. This led our colleagues in interventional radiology to talk about what if we treated the blood supply. And that led to an exciting procedure that I want to talk to you about, which is going to be hemorrhoid artery embolization. So you have the hemorrhoid, you have an artery, which is a blood vessel that goes to it. And then this term embolization just means stopping the blood flow to the hemorrhoid. It's minimally invasive, so we're not doing any surgery. We're not doing anything through the anus. Catheter base means it's through a pinhole in your skin, and we deliver the material to stop the bleeding through a small straw that's in your bloodstream. And we are targeting the blood flow. So we're approaching the hemorrhoid a little different. no cutting, no stitches, no tissue removal. HAE, hemorrhoid artery embolization, it targets internal hemorrhoids. This is not a treatment for external hemorrhoids. HAE does not treat external hemorrhoids. A lot of times people will have both internal and external hemorrhoids, but HAE is just for internal and it works best in the bleeding patient. And we'll talk about that in a minute. Okay, so how does it work? So you would we would get access to your bloodstream after confirming that you have internal hemorrhoids and that you are having recurrent bleeding from internal hemorrhoids and that you're a candidate for this procedure, which is those your symptoms. And we use something called a bleeding score. And confirming you have internal hemorrhoids makes you a candidate for our procedure. We use a small catheter, which is usually done through the groin into the bloodstream in the groin, and we guide ourselves to bring that catheter to the blood flow that goes down to the rectum. Starts actually higher up in your abdomen, closer to your belly button. So we find those arteries, and then we find the blood flow. And I'm going to show you a picture of what that looks like in a minute. And then we stop or slow the blood flow, and then that will cause the hemorrhoid to shrink. So here's a picture, here's a cartoon, and then our actual X-ray picture side by side of that small catheter coming down into the blood vessels that are feeding those purple things, or the hemorrhoids. We put these, they look like the spring inside of a pen, which isn't too far off of what it actually is, into those blood vessels that feed the hemorrhoid, and then those are gone. They shrink over time, few weeks to months. We have an X-ray image here, which is showing you it is abnormal beneath. I don't know if you can see my cursor, but this is an internal hemorrhoid, a pretty significant internal hemorrhoid caused and has recruited a lot of extra blood flow. That's what's keeping it, a problem. And this person had a lot of bleeding on both sides, a little bit more prevalent on the right than the left, but it's still there. And then you can see these are called coils that we used to block those blood vessels. And on the repeat angiogram, you don't see that contrast going down further. So those are the pictures that our physicians are going to look at while they're doing this type of treatment. Different treatments can solve different problems. So here's a table for just conservative treatments, which is doing the home remedies, the creams, and you're not going into the office for any type of procedure, making lifestyle changes around your diet, or deciding having a standing desk instead of a sitting desk. Then we go to their banding, which it is an office procedure. It can be painful, but the recovery tends to be shorter. It oftentimes needs to be repeated. Surgery is going to be actually cutting tissue. There's scars involved. This can be very painful. The recovery can be quite a bit longer, but it does work. And then HAE is different in the fact that it's targeting the blood flow. And the benefit here is it's in and out the same day, quick recovery. So HAE is a different approach from office procedures and from surgery. It's minimally invasive. Organ preserving. So here at North Star Vascular, all of our treatments are preserving the organ. In this case, it's just helping you avoid surgery. And fast recovery. You can be back about your day in your normal daily activities within 3 days. Who may be a candidate? If you have persistent bleeding, and so that can be daily, that can be weekly, monthly. If it's something that just bothers you every few months, even it could work. Confirmed internal hemorrhoids. We must have that have been diagnosed. We need to know that your bleeding is coming from internal hemorrhoids. You may have failed the conservative things. Hey, Andy, I've tried this and that and this cream and a different cream, and I tried suppositories. I've tried all kinds of things. Witch hazel, nothing is working. I've tried adjusting my diet. I've gone, gluten-free. I've gone paleo, whatever it may be. I've heard a lot of patients trying it, and they're trying it because hemorrhoids can be really bothersome. And if those are failing, it may be time for some type of treatment. So that can be a good HAE patient. Recurrence after banding. This can be common. Sometimes banding works great, and they don't need they don't have bleeding after banding, but sometimes it does. So if banding isn't quite getting you what you want, and you're continuing to bleed and having problems from your hemorrhoids, HAE is a great option. Or if none of the other options are, you don't align with them, or maybe you don't want to try those, and perhaps you'd want to try HAE first before you need a surgical option. Sometimes our patients are just like, no, I'm not having surgery. I've been on the Reddit forums for hemorrhoids. I've read some scary stories about surgery, and I'm sure some of those patients are too. And they're like, well, what's HAE? And of course, individual evaluation matters. Not every patient needs HAE. I just had a conversation with a patient this week, and I didn't offer HAE for that patient. He had He might have had something else that were causing his symptoms. He was describing itching as his most common symptom. He had some blood, but not much. And his might have been actually more from a skin problem, not necessarily hemorrhoid related, but it involves individual evaluation. Great thing about the recovery for HAE here at North Star, most patients go home the same day. And it's not most, it's everybody. Everybody goes home the same day from a hemorrhoid artery embolization. It's often easier than expected. There can be mild soreness. You return to activity quickly. And our restrictions are not related to the hemorrhoids themselves. They're only related to the bloodstream, the access into the blood vessel that we used. And we usually say no strenuous activity for 3 days. And you will see gradual improvement. This is easiest to see in a bleeding patient, but if you had feelings of fullness or you had prolapse, which HAE isn't just for prolapse, but it oftentimes can help it, you will see that gradual improvement over weeks to months. So the goal with HAE for internal hemorrhoids is simple: get your life back. I don't want you to make decisions to stay home or to change up what you're going to do in your life because you're worried about your internal hemorrhoid. It should be treated if that's the case, and we can get you back to doing the things you want to do. Another thing I want you to think of or to know is you have options. There are many different options for hemorrhoid care. We offer one particular treatment. We have friends in the industry who can do the other treatments, the in-office ones, the surgeries. If you were to see us, we can evaluate you and help you pick out what option fits best for you. Okay. I'm going to do some questions. I have a question. First question here I have is it covered by insurance? Of course, we got to talk about cost. Yes, it's covered by insurance. Most insurances will pay for it. Sometimes we have to do some prior authorization work. It is a procedure that's paid for. So therapeutic embolization is oftentimes there isn't much issues through insurance. There is one insurance company, Aetna, who has a medical policy saying that hemorrhoid artery embolization is experimental or investigational. And we can look into that for you, and sometimes we can fight that policy and oftentimes get approved. But we have a team that will help with that part. If we see you and you have that insurance and we found out there is a medical policy, then it might take a little extra work before the procedure, but we will do that on your behalf. How do I know I'm actually a candidate for HAE? Great question. Who's a candidate for HAE? Let's just say persistent bleeding is the best candidate, maybe prolapse, been going on for a while, perhaps failed banding, and either try banding and doesn't want surgery or just doesn't want surgery. That's a good candidate for HAE. Is the procedure painful? I see here. That's a great question. No, generally not. I would say the anxiety around it is probably more bothersome than the pain from the procedure itself. What you would feel is mostly going to be related to the access to the bloodstream and not necessarily in the rectum. Some patients will feel warmth from their injection of contrast in their pelvis or down their leg. It's not uncomfortable during the procedure itself. Not everybody, but some patients will have pain after the procedure. So a few days later, as that area is adjusting to its abrupt change in blood flow, it can cause a response in the body that's like, I don't know, you can think of it like a spasm, and it can be painful. So some people have called us who have had more significant rectal pain, and we can manage that for you. It's not that common, but it can happen. Typically, HAE is pretty straightforward and simple, and most patients don't say there's much discomfort. It can depend on your medical history too, but that's something that we can talk about at an evaluation. Another question here, I'm going to read it. It says, if I'm not sure I have internal, but I'm having bleeding, can you guys check that if I can't get in to see another doctor before? Absolutely. Yes, that's exactly what we would do. If you're having bleeding and you're concerned that it might be related to hemorrhoids, we would be able to check that out. We do something called anoscopy in our office, and we can confirm if that bleeding is coming from an internal hemorrhoid. Great question. Another one, how much time will I need off of work? That's a great question. My favorite way to do this is going to be scheduling an HAE on a Friday. Let's just use that as an example. If you take one day off of work and you be back to work on a Monday with our recovery, that's typical. So how much time will you have for work? One day at a minimum. If you had the HA on Monday, for instance, we would probably say to take off Tuesday and Wednesday and return on Thursday. And just about every time that is more than enough. Oh, this is a good one. Hard for me to answer, but which treatment is best for me? I don't know. Of course, it could be HAE, but there's a lot of questions I have for you. So I would probably be best to consult with you, see you for a specialist visit, and we could have a discussion and do an exam, and then we could talk about what the best treatment is for you. Will the hemorrhoids come back after treatment? Man, make an appointment and we can talk about that afterwards. No. Can it? Yes, of course it could. It's not necessarily like the ones we treated returned and caused issues. It's probably more like different ones that weren't problems before came back or didn't come back. Formed, right? So you had ones that pressure caused them to swell, the swelling caused bleeding. We treated that one. You were fine, patient was fine for a while, and then a different, it's not like a whack-a-mole, but like that, like a different blood vessel was now the problem issue, and that one enlarged, and now that's a different hemorrhoid. So very unlikely for the same one to come back, although it can, and we doctors Gozerian and Astani and I like to debate about, which blood vessel could be feeding in it. If you didn't embolize it, could it recur? And sure, recurrence is always a possibility, but it's not popular. Okay, another question here. 1 second. Get to it. All right. Can sitting down after be uncomfortable? Should you avoid it during recovery or stay at home? I sit a lot with my desk job. Great question. Usually not. If you are, and that's probably 20% of people who might have a little bit of rectal pain, then it might be uncomfortable to sit. So if that's the case, then you would probably want to be home where you would be able to stand or lay where it would be more comfortable. So can it be uncomfortable after an HAE? Yes. Yes, sitting could be uncomfortable after an HAE, but it's not often. I mean, most patients aren't complaining about even the drive home, or having to work if they go back to work on a Monday, for instance, and sitting at a desk job or sitting like I am now, or not hearing it being uncomfortable enough where they would call us and say they're in immense pain. But if you were worried because you do sit a lot or you have a desk job, then we probably should plan, just in case you're having some discomfort, that you probably would be distracted or not be able to work. Great question. Oh, here's a good one. What if I have both internal and external hemorrhoids? You're not alone, number one. Lots of people have both. It would be, I have a lot of questions for you because what is your main concern? What is your goal, right? You came to our office, so clearly it's something is happening that's bothering you enough for us to talk about it. And then I would have to dive into like what your problem is and what it could be coming from. If you just told me, Andy, I just can't stand the bleeding, and you had both external and internal, and on exam, the external hemorrhoids were mild, let's say, or they weren't thrombosed, and the internal hemorrhoid was prevalent, probably internal hemorrhoids are the one that should be treated. The opposite can be true. Someone can be really hurts when I sit down, maybe not as much bleeding, and their external hemorrhoids are very impressive, and their internal hemorrhoids are mild. Then it would probably be external hemorrhoids that we would target. And our clinic doesn't have options for external hemorrhoids. We have friends who can help that we would refer you to. Another question here. Is this a new treatment? I've never heard of this, but it is very interesting. Great question. Thank you for bringing that up. New in terms of medical treatments, yes, it's been around, started in France in 2013. So that's been a while now, becoming wildly more common in the United States of America over the past few years. So newer, yes. Studied though, well studied and helped a lot of patients also, yes. So there's a lot of research out for hemorrhoid artery embolization, and there can probably always be more, and we are interested in helping provide that. But it is something that we are trying to grow awareness. We want referring providers, primary care providers, patients, of course, our colorectal colleagues to know that if they're having patients who are not necessarily, or maybe have failed banding a few times and they don't want to go about another one, you don't want to tell that patient, well, you have no other options. So HAE can be a great option for that patient. So it's interesting and it's exciting, and it can work really well. So thank you. Yes, it is a new treatment. I don't like saying that because, in America, I like to say that we're at the cutting edge of medicine and treatments. And that's why we live here in Minnesota specifically is that. But you wouldn't believe how long it takes to get something as interesting and exciting as HAE to be kind of like widespread, right? You got to get it into the medical schools and into the PA schools and NP schools. And that takes a lot of time. And then these people who graduated from school, and I got a whole 20-minute talk on that. Maybe I'll do a webinar on that. But the answer simply is yes, it is. But it's been around enough to not be something that we're just doing without having evidence, right? So it's definitely evidence based and helped a lot of patients. Thank you. Great question. If that's all the questions, that's all I have for you. That's going to conclude our webinar on hemorrhoids and conservative treatments and home remedies, all the way up to minimally invasive treatments like HAE or surgical options for you. If you, oh, sorry, there's a QR code here. If you had any interest in me or our clinic, and we'd be happy to schedule an appointment to get you evaluated or point in the right direction. Thank you so much for your time. Again, it's Andy Manos from Star Vascular. Have a great day.